Hi, I'm Jordan. And my project is time to union and Pertrochanteric femur fractures, a cohort comparison of non-union complication rates between ballistic and blunt trauma. Civilian ballistic trauma is unfortunately increasing in prevalence in America, and ballistic injuries present unique challenges in management, such as comminuted fracture patterns, as well as significant damage to soft tissues and neurovascular structures. Historically, most of our information on ballistic fractures has come from military conflict, but civilian ballistic injuries are actually low velocity and low energy penetrating trauma. Pertrochanteric femur fractures are about 30% of all fractures with really good clinical outcomes and low non-union rates. The time to union has been broadly described as 12 to 26 weeks, and that's kind of because of all the varying different definitions of union. There's been very limited case series on ballistic pertrochanteric union rates, but the small case series suggests that they may have higher complications. This study was to assess the complication rates for ballistic pertrochanteric femur fractures and also compare the rate of non-union and time to union to a matched cohort of blunt pertrochanteric femur fractures. We thought that ballistic injuries might have heightened inflammatory responses, leading to decreased time to union compared to patients with blunt mechanisms. We did a retrospective chart review over a 5-year period. We excluded anyone with less than 6 weeks of follow-up, prior femur fractures, intracapsular extension of proximal femur fractures, pathologic fractures, as well as skeletally immature patients. And treatments of all fractures followed a standard institutional protocol. Union rates were described both clinically and radiographically. Clinical union was the absence of pain with ambulation at a fracture site, and radiographic union was an MRUST of greater than or equal to 11. We measured x-rays at regularly scheduled intervals, and a time to union was number of days from surgery to the MRUST of 11. And study endpoints were actually union revision surgery for a non-union or 6 months of follow-up without reaching union. We also recorded complication and revision rates. We ended up comparing 28 ballistic fractures to 35 blunt fractures. And results are listed here. All the patients were matched on the basis of age, BMI, sex, smoking status, and presence of diabetes. A few ones that I wanted to highlight was the average time for follow-up was very similar between the two groups, 176 days for both. We also had similar rates of loss to follow-up, 17.9% of ballistic fractures and then 17.1% of blunt fractures. Union rates were also not significantly different, 78% for ballistic fractures and 83% for blunt fractures. And again, the endpoints were union, revision surgery for non-union, or inability to achieve an MRUST of 11 by 6 months. And then the time to union was significantly different. It was 90 days for ballistic fractures and 115 days for blunt fractures. We had one non-union in the ballistic cohort. It was a 47-year-old male. These x-rays are from his 16th month post-op appointment. At that time, he was worked up for infection. All the labs came back normal, and he's currently being scheduled for total joint arthroplasty at U Chicago. We also had 6 additional minor complications. Overall, our union rates of ballistic pertrochanteric femur fractures was similar to those from blunt injuries. We found no difference in the complication or non-union rates, and we did find a difference of about 3 weeks in the time to union. And again, we are hypothesizing that this is likely due to the enhanced and widened inflammatory response of the blast effect, which may inoculate osteogenic material into the soft tissues and enhance bony healing. Thank you to my co-authors.